If you want to hit record, Sherry, we'll get started.
Okay, we're set.
Okay. Good morning, everyone. This is Debbie Melnyk from the VCSQI Support and Alignment Network. And today's web class is session 4 of 8 that we've done on TCPI's Project Pathway. Today we're going to focus on milestones that relate to identifying patient risk and using best practices. So for the specialty practices, those are milestones 7 and 11. And for primary care, they are 8, 9, 10, and 16. By way of reminder, there are 22 milestones for specialty practices, 27 for primary care, and scores on each milestone determine the phase completion. And we'll explain that a little more as we move through. For example, though, to complete phase 1, a score of 3 is necessary on milestone 13, and I think that is 18 for primary care. And this is the one that has you set a very specific aim for what you are planning to improve. Other phases require various scores for other milestones. So here we are on class 4, identifying patient risk and using best practices. The previous milestones have all been recorded, milestone classes have all been recorded. The links to these are on the VCSQI website, vcsqi.org. In addition, the email that you received from Jana on Monday has these links in them, and they will continue to be in the future newsletters that will, next week will be sent on Tuesday, but thereafter, every Monday, you'll receive a new update. And as you see, after this week, we have 4 more over the course of the next month. So today's objectives are to review the scoring for risk and best practice related milestones. We'll outline strategies for meeting each of these milestones and review the relevance of the milestones scores to phases. And then, of course, if you have questions along the way or at the end, we'll be happy to try and address them. So, milestone 7, we're going to address the specialty milestones first. Milestone 7 requests that a practice has a reliable process in place for identifying the risk level of each patient and providing care appropriate to the level of risk. This may include the risk of developing a health condition not already present, exacerbation of a condition or complications, or the need for a higher intensity of care, including hospitalization. Milestone 11 focuses on the practice's use of evidence-based protocols or care maps, where appropriate, to improve patient care and safety. There are 4 milestones around these 2 topics for primary care. Milestone 8, excuse me, focuses on the practice's use of a consistent approach to assign patients to a provider panel and confirms assignments with the providers and the patients, expecting that this panel assignment is reviewed and updated on a regular basis. Milestone 9 is the same as milestone 7 for specialty care, indicating that the practice should have a reliable process in place for identifying the risk level of the patient. Milestone 10, primary care. The practice provides care management for patients at highest risk of hospitalizations and or complications, and has a standard approach to documentation of this care. And milestone 16, the practice uses population reports or registries to identify care gaps and acts to reduce them. And we'll cover each of these as well. So let's look at milestone 7. Here's the scoring for milestone 7. And in almost all cases for the milestones, the scores range from 0, where there's no activity on that topic, to 3, which is meeting the milestone. Usually 1 and 2 are somewhere in between there. In this case, the practice is a process for identifying high-risk patients, but it's not used consistently. A score of 2, the practice has introduced a standard process and is developing corresponding descriptions of the type of care required at each level. So As I'm sure you've begun to get familiar with, the scoring improves as you've identified, implemented, and consistently use and document the activity described by the milestone. So I want to show this slide to indicate where we are pulling strategies from. All of you have a transformation work plan that Ivan, Sherry, or I have been showing you. The work plan begins with your initial baseline practice assessment scores. And we, on our end, we copy paste your scores into a tab called Inputs and Instructions. And by doing so, a practice plan is created. So in this case, I'm just showing, you know, a copy paste of a slide here. So with phase 1 in this practice plan, the milestones are listed according to the phase that they have a relevant score for. So here, phase 1, only milestone 13 on the specialty list is associated with completing phase 1. In this case, it shows the score was 0, which means the practice has not yet begun developing its transformation vision, and what they have to do is develop a vision and plan, and that will get them a 3, and they can get out of phase 1 and move into phase 2. So for each milestone, for each phase, all the way over here in column H, in most instances, here you see there is a none, but there is a link that will, when you click on it, actually take you down here to the change package, still built into the transformation work plan. So as we show you the strategies for helping to meet these milestones, they're coming from these links. That's my reason for showing you this slide and kind of explaining how this work plan works. So for milestone 7 on the specialty practice list, a score of 3 is needed to complete phase 4. And in all instances, we try to show you which phase a score of 3 is associated with. So here, in the Change Package tab 1.3.3, all these various strategies are offered to you as a way to help meet this milestone. It doesn't mean you have to do all of them, but you want to look at the ones that will help you address the specifics of a phase 3, of a score of 3. Identifying a risk stratification approach and using it consistently. Assigning responsibility for care management. What's meant here is that you're matching the care necessary for the risk level. So for example, if you have a few clinicians in your practice and some have more expertise with a particular high-risk type of patient in your specialty, you might match that patient with that clinician. And a particular protocol, perhaps, that helps to address the risk factors that patient has. Implementing a standard approach to documenting all of this on your care plans, using a consistent method to assign and adjust global risk status. And as you can see, these all address using a standardized risk approach and matching it to the care necessary to address that risk or minimize the risk of future, additional complications. Using panel management and registry capabilities, Sherry's going to talk a little bit more about when we get to the primary care milestones as well. And then engaging patients at the highest risk in ongoing development and refinement of their care management plan. And here you want to integrate their goals, values, and priorities. So this hopefully sounds a little familiar to you as one of the person and family engagement metrics where we talk about patient activation, getting the patient to a level where they know about their condition, they're engaged, and they're taking on managing their health in a way that optimizes their outcomes of care. So what are some examples here of risk management tools? Dr. Ibarra is on the call, and yesterday he and I spoke about how their surgeons use the ASA score as a subjective assessment of a patient's overall health that's based on 5 classes. So the ASA score is pretty universally used in the surgical setting now, addressing the patient's risk for anesthesia, and it definitely relates then to how that patient is cared for while under anesthesia. So you can read more about ASA score for those of you that are surgical practices, but you're probably familiar with this one already. Here's an example of a stroke risk assessment tool. In this case, the questions are answered. I'm trying to get my browser thing out of the way for me. The questions are answered, and then down at the bottom, you can check calculate risk. So this would be another example that could be used in a primary care setting or a neurology setting, or some other kind of general setting where understanding the patient's risk for stroke would be important to the care you provide. And my slide is, there we go. Okay, so another example of a strategy here, there's a second slide actually, because there were so many strategies offered in Change Package 1.3.3, is to use the Medicare annual wellness visit with the personalized prevention plan services, using social determinants of health to assess risk stratification. Again, assessing patient engagement and willingness to address care gaps, allowing for the common sense addition to high risk for things that you know are going to put the patient at greater risk. No algorithm is perfect. Identifying ways to graduate patients from care management when goals are met as appropriate. Including the patient and family in the plan of care and giving it to them so they understand it. 5-minute daily huddles to plan for the day, and using the risk level to identify the best provider. One of the things Ivan mentions on this strategy, he wasn't able to join us today, is the use of these 5-minute daily huddles, which might be overlooked by your practice as a strategy that helps to meet this milestone. These are the huddles that you may have at the end of a day when planning the next day, or even in the morning when your staff comes together and looks at, who's coming in today and what's important and what risk might this patient present with and what do we need to be sure we cover with them. So these 5-minute huddles are another way to have a kind of real-time discussion amongst the staff about the risk that your patients today are bringing. Certainly in the inpatient setting, rounding in the morning is another method for addressing risk, understanding the patient's risk and addressing it. Somehow you want to note that these do occur. They're a little more, on the fly kind of discussions, and they're not always documented, but it definitely is a way to assure you are looking at your patient's risk levels and attending to them. Okay, milestone 11, practice uses evidence-based protocols or care maps where appropriate to improve patient care and safety. So here again, a score of 3 is needed to complete phase 4. One of the things that I know Sherry has mentioned with how she works with her practices is if you're at a 0 or a 1, she doesn't want to just help you move 1 score at a time. She wants to help you get to 3 as quickly as possible, as we all do. And I think that's a good strategy to think about. So here again, you see a 0 is indicating practice is doing nothing about using protocols. And when you get to a 1, they've identified groups for which a care might be appropriate, but not yet developed them. 2, they've developed them, but not using them consistently. And 3, you're meeting the milestone. You have evidence-based protocols or care maps where appropriate, and you're using them consistently. So what are some examples here of strategies? In this case, we're looking at Change Package 1.6.3. And here we see that you can develop evidence-based protocols in-house or use those developed perhaps by professional societies or other health systems that have particular expertise in the type of patient that you're looking to standardize care mapping for. You can document your protocols by using flow sheets, process maps, care maps, swim lanes, other visual ways to actually describe the steps and the care that should be taken with these patients that you're focused on. You can invite visiting faculty from an academic setting or, again, another health system that you know has particular expertise. And that should be embedded in EHR, not in HER. We know that these tools that we use to document things like to turn EHR into HER. You can use protocols to guide communication with patients and families, particularly after a patient safety event. You can embed your protocols in the EMR and use condition-specific pathways for care of chronic conditions that include evidence-based protocols to guide treatment to targets. So the diagram here simply shows how you might go about implementing or developing some clinical guidelines, so that you do have a clear protocol for a particular type of patient. Here's an example of an assessment protocol. I think as you read through it, you'll see this might have been one being used in the emergency room, where a patient maybe comes in with some kind of head injury. And so this is just a step-by-step, assessment to understand where the patient's signs and symptoms lead you to in terms of understanding the degree of injury, and then the type of pathway that might be necessary. That's down at the bottom there: hypovolemia, acute respiratory insufficiency, or head injury. And again, it's one of the comments Ivan makes is that he's found with practices that they're not taking advantage of thinking visually about the steps that they go through or that should be used to appropriately either identify the patient's problem, in this case, an assessment protocol, or providing the care that has been deemed effective with leading to positive results. Okay, so that really concludes the 2 milestones focused on risk assessment and use of evidence-based practices for specialty care. So now I'm going to turn the mic over to my colleague, Sherry White, who will address the primary care milestones. Sherry?
Thank you very much, Debbie, and good morning, everyone. So again, I'm focusing specifically on the primary care milestones associated with risk. The first one is milestone number 8. And it states that the practice uses a consistent approach to assign patients to a provider panel and confirms assignment with providers and patients. Practice reviews and updates panel assignments on a regular basis. So again, we have our normal scale, which is 0. There is not a consistent assignment of patients to provider panel. Scaling up to a 3, where a 3 in this specific milestone will get you past phase 4. So a 3 states that the practice has assigned all patients to a provider panel and has confirmed assignments with the provider and patients, and the practice reviews and updates the panel assignments on a regular basis. So just to be specific, we'll go into more detail as it relates to what panel management is. It is a set of tools and processes for population care that are applied systematically at the level of the primary care panel, with physicians directing proactive care for their patients. And more information for panel management can be found in the citation below, referring to you to a specific article. Next slide, please, Ms. Debbie. Thank you very much. Okay, so now let's go into some different techniques as it relates to achieving a 3 for the specific milestone. So we're going to refer to change packet 1.3.1. I'm not going to go over through all of them specifically, but I will share with you some examples in the slides to come. So let's look at the use of a four-cut method. And in the next slides, I'll give you an example of what the four-cut method is, but that is something that you can use, or a different type of approach similar to that to develop initial panel assignments. Determine guidelines for the panel size and patient complexity per panel. Refer to care team as a team as opposed to the physician, advanced practice clinicians only. So just to restate this, instead of saying the doctor, just say a member of the team, so it feels more inclusive to the patient, as if there's a whole system of bodies helping to take care of the patient's condition. Pictures of a care team when patients enter the exam room, which will help with the triage link, or with the linkage. So in a practice that I worked with previously in my years, my golden years, as my daughter would say, we had bio cards for our physicians, and it indicated their history, their expertise, their specialty, where they went to school with. And we expanded on that a bit, creating bio cards for the specific care team of specific disease types. Again, we expanded at it even more, and we made cards for everyone in the entire department and just passed that out to everyone, all of our patients, so they can become familiar with everyone in the practice and knowing who does what. So it's a good tool to utilize. The last one for this specific sheet, I'm going to focus on determining the panel size according to the patient's risk level and utilization. And again, it's based on what the specific diagnosis and the level of risk. You assign the appropriate size of participants or team members to help address that specific issue. So the next slide. Ms. Vanna, thank you. So this is an example, and we'll take you to this hyperlink. And this is a practice facilitation handbook. And this refers directly to panel management, letting you know the who, what's, when, where, and why. It's just the whole overarching, everything you need to know guide for practice facilitation. So this is a good tool, resource for you, and we'll make sure that we provide this PowerPoint presentation to you so you can have the active link. And again, it focuses on the size of the panel, how do you assign patients to the panels, but everything you need to know. And there's some pretty unique tools and resources here, worksheets that you can use to help you apply this to your practice. All right, so going back to the slide, Ms. Debbie, thank you very much. Okay, so let's go on to the next slide. So in the prior slide, I mentioned something of the four-cut methodology. Above is that link. The link is a toolkit, which is probably just one page, highlighting the specifics here. And Debbie or Ms. Vanna is going to take us there now. And it just outlines for you first cut based on, again, the primary care level. If you have a patient who has seen multiple providers, who do you assign that patient to? And this is just some specific guidelines to help you to determine where the patient should be paired. So this is also a very unique tool, and it gives you an example as well. So going back to our presentation. Okay, just exploring the benefits of the practice. This four-cut method helps to create efficiency through reduction of intensive chart reviews. It controls the costs and reduce the duplication of tests, which is another milestone that we have to address in your change panel practice plan, sorry, as it relates to reducing duplication of tests. It defines a process of fair distribution of work. I think all aspects, no matter what level you are in the healthcare, the fair distribution of work is something to always be focused on, and this is a tool that will help. Data-driven decision support, supporting practices and support. Let me restate that. Data-driven decisions supporting practice management and support. So again, this is another tool that will help in that aspect, and this is the benefit of that.
Sherry,
Yes.
the other day when Ivan was on the call with us, he mentioned a practice he'd been working with who for years had just done a 50-50 split between the two clinicians in the practice. You know, the next patient in goes to you, patient after that goes to me, and they just kind of did it that way based on 50-50 assignment. And a few months ago, they sat down and actually began to review each other's strengths and interests and came up with a new way to assign patients coming in that kind of matched their interest and strengths. And I think from what he said, they found that to be very effective and a good way to practice. So
Yeah. I like that approach. Very good. Yeah, it's always good to do something if you pair the physician up with what they enjoy doing or the focus. It's just better efficiency. Thank you so much for that example.
Mm-hmm.
So moving on to another milestone for primary care. This is milestone number 10, which states the practice provides care management for patients at high risk of hospitalizations and or complications and has standard approach to documentation. So again, we have our scale here, which is 0. Patient has not identified a process. Scaling up to a 3, which is what is needed to pass on to the next phase, which is phase 4. So a 3 is needed to pass on to phase 4 for milestone number 10. And a 3 states that the team consistently provides care management for patients at high risk of hospitalization and or complications and has a standard approach to documenting care management plans. So now let's dive into some examples of meeting this milestone. All right, so this is relating to the same package Debbie reviewed earlier, milestone 9. I'm not going to reread this milestone or this change packet, but this is relating to change packet 1.3.3. So I'm just going to dive into a couple of examples to show you how this milestone can be applied to a primary care practice. So let's look at the Medicare annual wellness visit. So here's a link, and again, we'll provide you this PowerPoint so you can have this handy dandy tool. But this is a pretty extensive toolkit, 14 pages, and it identifies why health risk assessments are important, how do you apply it to the setting, what type of tests are associated with that type of visit, the wellness visit. And it's just a thorough checklist, well-defined, very detailed as it relates to what is required to achieve this annual wellness visit. So excellent. See, it's a lot of information. All right, and a clinician guide, we'll make sure we'll activate that hyperlink and send it to you, but a login is required, and this is in Medscape, just an article to expose you to more information. And also, there's another tool we'll provide for you relating to yearly wellness exams provided to you by Medicare.gov. And it's also just a resource to utilize to help identify and thoroughly take you through the requirements of yearly wellness exams by way of Medicare. Thank you very much, Ms. Debbie. Oh, and these are just screenshots. We took you to the actual website. I actually like this tool. So a lot of times in our healthcare, as patients, focusing on patients are a big participant of their own care. So especially if our older patients or some more senior patients, and just helping them to be more involved in their care, this is a great resource that you can use, print out, and provide to your patients to tell them or help to enforce why their participation in healthcare, in their care, is important. And this gives them tools as it relates to making sure you follow the instructions that your provider gives you. And it tells them the whys and the risks of if they don't. The importance of exercises and eating healthy. It's just a very thorough, detailed document that helps provide a better understanding to our older patient population, exposing them to why it is helpful for them to be involved in their healthcare as it relates to preventing hospitalizations. Next slide, please, Ms. Vanna. All right, so this is a link that we'll provide for you to an article relating to prevention of hospital readmissions as it relates to specific heart failure. Just take a look through this, and it also provides some guidelines, clear-cut details as it relates to preventative measures for readmission. Next slide, please. All right, so we're almost done. The next milestone is milestone number 16. The practice uses population reports or registries to identify care gaps and act to reduce them. So 0, the practice has not collected data on care gaps for its population of patients. Scaling up to a 3, which is what is needed to progress to the next phase, which is, I know it's in the next slide, but I'll tell you. Phase 4, actually. So a 3 is needed to progress on to phase 4. So a 3 indicates that the practice analyzes care gap reports for prevention and chronic conditions or diagnosis prevalent in the practice patients population, and has a system in place to regularly act on the data, including outreach to individual patients needing intervention. So what are some ways we can do this in our practice? Okay, we're going to refer to change package 1.6.4 related to the specific milestone. And this pretty much focuses on adding tools into your EHR, designing your EHR to add pop-up reminders to appear as part of the scheduling module. So this will call into the work of your schedulers, the front desk personnel, to just have your EMR populate some pop-ups to address this specific milestone. Use your EHR and payer care gap reports. Include medical residence assessments, not just faculty, for the care of gap reports in academic settings. Also use clinical decision support such as the ACR Select. So we're going to go to the next page, and this is another tool, 5 ways to close the gap in care and build a successful quality improvement program. So you're participating in TCPI, which is transforming clinical practice initiative focused on quality. This is a clear-cut method or a useful article to help you to assess or design interventions in your practice to help you close the gap in care. So this resource will be provided for you. And previously I spoke about ACR Select, which is just example pictured here. The website is above, and ACR is the American College of Radiology, and also just a composite of different case scenarios that is very useful in radiology and non-radiology types of settings. Okay, and before I go on to ask for any questions, is there anything you wanted to add, Debbie?
Let's see, just maybe noting that when it comes to panel management, it's not panel management, I'm sorry, this last milestone 16, it's just good to ask, as a group or even as an individual clinician, whether you're being proactive with actually managing the population of patients you serve, and are you using your EMR, if you have one, to prompt those kind of assessment questions. Using the tools that Sherry referred to as well will help you further understand this population management milestone if it's still unclear. So that's really all I had to add. I think you covered it well, Sherry.
Thank you very much. That's a very good example. So now we'll open up the floor to you all to see if you have any questions or specific examples you wanted to share. Okay, so I will take that as a no, and of course, if you have any questions or concerns, you can reach out to Debbie, Ivan, or myself, but these are milestones that we will go over in more detail on our one-on-one calls. So I do want to remind you that next week we have another fascinating presentation.
I'm trying. There we go.
I heard you click, it just didn't work. Sometimes technology is not the best. So next week, the week of September 3rd, however, Monday is a holiday. Happy Labor Day to you all. So our next presentation will be Tuesday, and it will be focusing on streamlining clinical and office work, which is a very fun topic. So you all have a wonderful weekend. And of course, please feel free to reach out to us if you have any questions or concerns.
Thanks, everyone. Happy Labor Day.